Hello, I'm Cam Patterson, Chancellor of the University of Arkansas for Medical Sciences. Today, the UAMS Fay W. Bozeman College of Public Health releases new projections on the effects of the coronavirus in Arkansas, just as they have done every 2 weeks for the last several months. These projections rely on current data provided by the Arkansas Department of Health and on conditions remaining the same. In today's report, the 15-day forecast continues, predicting an increase in the number of daily cases, hospitalizations, and deaths due to COVID-19. The models predict cumulative confirmed cases in Arkansas of more than 112,000 cases by November 16th. If we include probable cases, that number increases to more than 121,000. The model predicts about 7,900 cumulative hospitalizations and 2,200 cumulative deaths by November 16th. Projections continue to be that Arkansans between 35 and 59 will experience the highest number of COVID-19 cases. Young adults 18 to 34 will have the second highest number of cases. These two age groups will make up about 68% of the COVID-19 caseload. All counties in Arkansas reported new COVID-19 cases in the last 2 weeks. 2 counties, Cleveland and Sevier, had 2-week rates of change greater than 100%, and 12 counties had rates of change greater than 50%. The long-term models continue suggesting the pandemic will peak in late March or early April of next year with between 20,000 and 63,000 active infections. I want to thank the College of Public Health faculty and staff who continue to produce these models. Now I invite Dr. Ben Amick, Associate Dean for Research in the College of Public Health, to explain the latest models in more detail.
Hello, everyone. Thank you for joining us again for the Arkansas COVID-19 Pandemic Report. Today, we will first look at cases, move on to hospitalizations, and then look at deaths in Arkansas due to COVID-19. Last time, we concluded the report with some takeaway points. As usual, we begin with the 15-day forecast of daily COVID-19 cases. As shown on this slide, COVID-19 cases in the state continue to grow, with little change in the growth curve since July. The 15-day model, with only confirmed COVID-19 cases, continues to increase with little change in the rate of growth of the growth curve since early July. The model is forecasting 112,101 confirmed COVID-19 cases by November 16th, an increase of 7,738 confirmed cases over the number reported on November 1st. In addition to confirmed cases, we use the 15-day model to forecast future cases using both confirmed and probable cases. The 15-day forecast of cumulative confirmed and probable cases is 121,627 by November 16th, as shown on this slide. The greatest growth in cases will continue to be in adults 18 to 59. This slide shows the results of the 15-day model, which is forecasting 39,846 confirmed cases in adults 35 to 59 by November 16th. The second highest growth in cases will be in young adults 18 to 34. The model is forecasting 35,960 cumulative confirmed cases in young adults 18 to 34 by November 16th. Together, these two age groups will account for 68% of the COVID-19 caseload in the state. The lowest growth will be in adults over 75, with a projected 8,265 confirmed cases by November 16th. As shown on this slide, the 15-day model is forecasting increasing cases in all racial ethnic groups in Arkansas. However, the model forecasts the increase will be greater in whites. Indeed, if we compare the slopes for blacks and Hispanics to that of whites, the slopes are increasing far more modestly in blacks and Hispanics. The 15-day model is forecasting 60,826 cumulative confirmed COVID-19 cases among whites by November 16th, an increase of approximately 10,000 cases over the number reported to the health department through November 1st. This map shows the number of COVID-19 cases per capita for each county in Arkansas. Per capita rates can be used along with other data to draw conclusions about how COVID-19 is spreading throughout the state. Per capita rates are concerning when high. The three counties with the highest per capita rates in the last 2 weeks were Poinsett, 81, Craighead with 63, and Greene with 59. What we can conclude from this and other data is that the pandemic has now firmly established itself in rural areas throughout the state, but most predominantly in the northeastern and western counties. These counties have comparatively high per capita case and relative change rates. The midterm forecast provides a look at what might happen between the end of November to the beginning of 2021. As shown on this slide, the model is forecasting 150,777 cumulative confirmed COVID-19 cases on December 31st. The forecast growth rate is 2.6% per week. If the forecast holds true, Arkansas will add 50,000 new cases over the number reported to the Department of Health on October 31st. If we include estimated active cases not reported, largely because they are asymptomatic, we can expect an additional 20,000 active cases. This slide shows the long-term projection of cases in Arkansas. The long-term ESEER model is projecting the peak of the epidemic in Arkansas will be in late March or early April, with a mean prediction of 35,718 active infections. The light pink shaded region shows the 90% confidence interval. For the long-term projections, the timing and number of cases at the peak of the pandemic has not changed substantially from previous reports, although the lower bound of the confidence interval has expanded downward. What this suggests is a degree of uncertainty in the model greater than in previous reports. We expect a certain amount of uncertainty in the model as recent cases continue to rapidly increase. This slide shows the 15-day forecast for COVID-19 hospitalizations in the state on November 16th. The estimated trend in hospitalizations is consistent with the increasing trend in confirmed cases. The 15-day model forecasts there will be 7,893 cumulative hospitalizations in Arkansas by November 16th, an increase of 801 hospitalizations, or 11% over those through November 1st. This slide shows a similar growth for patients needing intensive care. This is an important statistic because intensive care patients require greater resources with respect to medical personnel and supplies. The 15-day model is forecasting 2,627 COVID-19 cumulative intensive care patients by November 16, an increase of 197, or 8% over November 1st. The forecast of hospitalizations by age is shown on this slide. The current report forecasts the greatest number of hospitalizations will be in adults 60 to 74. Adults 60 to 74 are forecast to have 2,545 cumulative hospitalizations by November 16th, increasing by 290 hospitalizations. This compares to 2,454 hospitalizations in adults 35 to 59, the second highest number. All races are forecast to show steady increases in hospitalizations. As expected, the majority of hospitalizations were noted in whites. By November 16th, we expect hospitalizations to rise from 3,822 to 4,545 among whites, 1,919 to 2,331 among blacks, and 744 to 925 among Hispanics. Evaluating the distribution of hospitalizations across the state can help understand the impact COVID-19 may have on regional and state health system resources. This map shows hospitalization rates per 100,000 residents. 67 of the 75 counties in Arkansas have hospitalization rates per 100,000 greater than 100. This means that 1 out of every 1,000 people has been hospitalized for COVID-19 in nearly every Arkansas county. The counties with the highest per capita hospitalization rates are Lee, Chillicothe, and Hempstead. For these 3 counties, 1 out of every 200 residents has been hospitalized for COVID-19. This also effectively demonstrates that COVID-19 is firmly established throughout the state. The 15-day model is forecasting 2,202 deaths by November 16th, as shown on this slide. The forecast is an increase of 357, or 16% over deaths reported on November 1st. Our previous forecast of COVID-19 deaths was within 5% of actual numbers. This model forecast 1,925 deaths by November 1st. The actual number was 1,845, a difference of 80, a very small difference. The midterm forecast of cumulative deaths in the state on December 31st is 2,887. This is an increase of 1,042 deaths compared to actual deaths reported to the health department on November 1st. The weekly growth rate of deaths through the end of the year is forecast to be 2.4%. Finally, as part of the Arkansas Pandemic Poll, we used a scientifically accepted measure designed to assess vaccine acceptance in the general population to understand the challenges to implementing a vaccine delivery program in Arkansas. Essentially, the measure assumes a person's decision to accept a vaccine is the product of an evaluation of vaccine safety, vaccine effectiveness and necessity, acceptance of the selection and scheduling of vaccines, beliefs about the positive value a vaccine has for self and society, and legitimacy of government to require vaccines. This slide shows the results for vaccine acceptance and these subscales just described. The highest score a person could get is 7 and the lowest 0. In our assessments, we found differences for vaccine acceptance by race, ethnicity, and beliefs about pandemic mitigation efforts, such as wearing face masks. We found blacks have lower vaccine acceptance than Hispanics or whites, and differences center around perceived vaccine safety. We also found that the more a person agrees with COVID-19 mitigation practices, the more likely he or she is to accept a vaccine. Even with these differences, we found overall Arkansans are tepidly accepting of a future COVID-19 vaccine. There are several takeaway points I want to leave you with. Arkansas and the rest of the United States, as we've emphasized during our last report, is entering a dangerous period in this pandemic. The first takeaway is the number of cases is forecast to rapidly increase. The midterm model is forecasting approximately 50,000 additional COVID-19 cases in the state by December 31st. If we also add in the number of undiagnosed cases in the state, there could be 70,000 active cases between now and the end of the year. Second, the growth in cases will obviously have an impact on the number of hospitalizations. The forecast cases and hospitalizations continue to be worrisome, especially for older Arkansans. More than 25% of adults 60 and over who tested positive for COVID-19 will be hospitalized. If this happens, hospitalizations and unfortunately deaths will also dramatically increase. Third, the highest impact of COVID-19 on the hospital system is likely to be on smaller county and community hospitals. These hospitals are where rural COVID-19 patients are likely to first encounter the hospital system. Large numbers of COVID-19 patients, a third of whom will require intensive care, are very likely to strain an already strained rural healthcare system. Fourth, with the very recent announcement of an effective COVID-19 vaccine produced by Pfizer, our vaccine acceptance findings point to the importance of using evidence to guide the state's vaccine implementation efforts. Thank you.